Hello, everyone. I'm Dr. Shela Hirani, Associate Professor at the University of Regina, Faculty of Nursing, Canada. The title of my today's presentation is Baby Friendly Initiatives to Promote, Protect, and Support Breastfeeding Practices of Immigrant Mothers, a qualitative study in Saskatchewan, Canada. Disclosures. I acknowledge that there is no actual or potential conflict of interest. First of all, background. Immigrant mothers often experience the trauma, family separation, forced migration from one country to another, and social disconnection in the new country. And most of the time, they are at a very, very high risk to their overall health and well being. This vulnerability often has a negative impact on the immigrant mother's well being and breastfeeding practices, mainly due to social, emotional, psychological, and physical stressors. The challenging transition of immigrant families could not be ignored. Whenever immigrant mothers are arriving in the new country, they often present with the language difficulties, inadequate health insurance coverage, lack of access to the healthcare services, and inadequate breastfeeding support in the new country. Each year, Canada welcomes a large number of immigrant families from different parts of the world. Talking about one of the provinces in Canada called Saskatchewan, this province has the noticeable increase in the immigrant families who are with the young children. And most of the immigrant families migrate to this province in Canada from the different parts of the world, including Asia, South Asia, Africa, Europe, Middle East, Afghanistan, Eritrea, Ethiopia, Myanmar, Rwanda, Somalia, and Sudan. Saskatchewan, as the main province of Canada, has a noticeable increase in the immigrant population with the young children. And unfortunately, this province has only one healthcare facility with the baby friendly status and has a very limited number of healthcare facilities that are providing the services specifically to the immigrant mothers with the young children. So overall, there was a knowledge gap, and there was a significant gap in knowledge was noted surrounding that what are the facilitators and barriers to the breastfeeding practices of immigrant mothers in this province. And it was really essential to explore that what are their challenges and experiences and what are way forward and what are some of the important need-based baby-friendly initiatives and interventions that are really required to promote, protect, and support the breastfeeding practices of immigrant mothers in Saskatchewan, Canada. So, the aim of this study, the qualitative study that was undertaken in this province, basically aimed to identify the challenges and the need based baby friendly initiatives so that altogether we have a way forward so we can promote, protect, and support the breastfeeding practices of immigrant mothers in Saskatchewan, Canada. We employed the critical ethnographic study design in order to seek the recommendations from the immigrant mothers who were belonging to the diverse ethnic groups. And we basically identified some of the need based initiatives and baby friendly um, endeavors that can really promote and protect their breastfeeding practices. So, as I mentioned, this study was undertaken in Saskatchewan, Canada. The data was collected using the multiple methods, including the in depth interviews, observation, and document analysis. We undertook the in depth interviews with the 30 immigrant mothers having children aged 1 day to 24 months. I would like to acknowledge here the support received from Saskatchewan Health Research Foundation, and I'm very thankful to the collaborators, the community based organizations who are the patient partners. So they were of great help in the recruitment phase and in the knowledge translation phase of this study. So now the findings. There were many barriers to the breastfeeding practices of immigrant mothers that were noted in our study. Our participants spoke about the psychosocial barriers because of no support in here in the new country. And they specifically spoke about them when they were living with their extended family in their home country. They were availing more breastfeeding and informational support as compared to while in Canada, where they are having not many contact with their own people, and especially the extended family members are not there. Women also spoke about the healthcare barriers. They mentioned about that there are many healthcare barriers, just like lack of transportation. At times, the healthcare insurance is not covering most of the services for those mothers, and at times the healthcare is not very much supportive of their breastfeeding practices, and healthcare providers don't know their languages. So that's another layer of the barriers. Mothers also spoke about the variety of environmental barriers, specifically the cold weather and traveling to the healthcare facility during that time with the young kids with no transportation of their own, and using the public transportation do have their add-on kind of the issues. And then also moms talk about the how COVID-19 negatively impacted their breastfeeding practices when they were having no direct contact or follow-up care from the healthcare providers. Mothers also spoke about on the language barriers that they are facing while being in the contact with the healthcare providers, and whatever the information is being shared with them is not something that they really can understand most of the time. And similarly, it's vice versa. They are also not able to share their needs with their healthcare providers. Women who were working and immigrants, they also spoke about various workplace barriers, lack of flexibility, and no time or space to breastfeed. Moms also spoke about that there were many maternal and child related barriers, and mothers who had the difficult labor or like the C-section, or they were more into the situation where their babies were born preterm or with any kind of the disability, and that was a time when they were facing more add-on barriers to their breastfeeding practices. So these were holistically all the barriers, and now we're going to talk about that what are some of the baby friendly initiatives that came out of from the recommendation of the participants. So the first theme on recommendation is on the support from the social network. Women highly emphasize that they really require the emotional, tangible, psychological, and informational support from various people in their social network, including the healthcare providers. Even women acknowledge the support from their spouse and partner while being in Canada, because they are already away from their extended family members who can provide them all the support, but they really acknowledge that whenever they have the support from their partner, spouse, or people in their community, or even if the government is giving them some stipend or the extra programs or services that are specific to breastfeeding, then that something is really very, very helpful and a kind of a very important baby friendly initiative in their social environment that is supportive of their breastfeeding practices. So one of the mom, while expressing her recommendation and requirement to have the emotional support for all mothers, specified as I quote, as an immigrant mother, we always miss our family to be around us to emotionally support us. For me, I was tired psychologically more than physically. I needed psychological support so much, unquote. Another participant shared, as I quote, I think having good knowledge and good support are two major factors that contribute to being able to properly breastfeed, unquote. So these quotes are indicative of importance of the social supports network towards the breastfeeding practices of mothers. Another important recommendation was on the baby friendly initiatives in the healthcare settings. And moms specifically identified that not only in the hospital but also in the community based settings, they are really looking forward for better breastfeeding counseling facilities and breastfeeding education that are targeted to them before and after their childbirth. Also, they requested for more educational resources, the 24/7 helplines and follow-up care that provides all those care and services specifically in their own languages and that are timely and need-based. Here, one of the participants' quote I would like to share as I quote, I recommend breastfeeding advocates and breastfeeding consultants at the hospital that have knowledge to avoid and solve problems. If they were available, they would make me save my breast milk, discover the tongue tie problem in my baby, and prevent the clogged duct from happening. Unquote. So this code is indicative of that how much important the baby friendly initiative movement in the healthcare settings, because that is not only serving the preventive purpose but also like it's a better screening on time and better problem solution that could be sorted out, and problem solving can be instilled right on the right time. Mothers also spoke highly on the importance of having the culturally sensitive care in all healthcare settings, and they specifically spoke on the culturally appropriate food and clothes in the hospitals. Many mothers who were immigrant and were coming from the countries where they were preferring the specific type of food based on their religion and culture. So they really look forward to have the better quality and the quantity of the food that is as per their religious needs and dietary restrictions. And many mothers who were like wearing scarves or like preferring the privacy while being in hospital and breastfeeding, so they actually recommended that they should be allowed to wear their culturally appropriate kind of a drape or scarf, whatever is their religious belief. It should be very well respected. Mothers also spoke highly on the availability of the interpretation services that are most of the time not available. And they spoke highly on this important aspect because many mothers were not able to communicate their needs or even understand the healthcare professionals. Education on breastfeeding if there were no better interpretation services who could provide them the need based guidance. Mothers also recommended the need for the breastfeeding helpline and offering the services in the multiple languages, specifically for mothers who were immigrant and refugees and not very well able to understand English or write in English or read that language. So they really highlighted the importance of this aspect. Another important theme from our study was on the anti racism movement. Mothers spoke highly that there is so much of the racism that they face in healthcare settings and society at large, and they really look forward to have a non judgmental attitude from the healthcare providers and general public. And they really felt that this is something whenever they face the racism that really affects their health and well being and indirectly affects their breastfeeding practices. Mothers also spoke on the acceptability of the breastfeeding in public. Many mothers who were immigrant and new to this country, they found that the culture here and the culture in their home country quite different. So many really look forward to have the public acceptability of the breastfeeding in the variety of the public places, including hospitals, workplace, airports, restaurants, public park, and the public transportation. Even mothers recommended for a privacy to breastfeed, especially the breastfeeding room where they can breastfeed and there is no judgment or like any criticism that they are facing from anybody, and they can actually respond to their child's hunger on right time. Mothers who were immigrant and also employed spoke highly on the supportive workplace, and they actually identified the need to have a baby friendly workplace settings where they receive the support from their employers, the colleagues. There are private spaces to breastfeed, and there is a flexibility and enough time provided to them to breastfeed. Many immigrant mothers who were joining the employment because of the financial needs in their family, being a new migrant, they were really facing the barrier that were of financial nature. And they mentioned that they really go to the different type of the workplaces where there is no privacy, and whenever they have to pump their breast milk, they have to use the restroom, which is not at all baby friendly or like hygienic. So they were really looking forward for better supports in the workplace and better understanding from their workplace supervisors and colleagues and overall. So here are a few key recommendations from this study. And our first recommendation is that the breastfeeding support in hospital, home, public places, workplace, and society at large is essential to promote, protect, and support the breastfeeding practices of immigrant mothers in Saskatchewan, Canada. Our second recommendation is that it is essential to involve the immigrant mothers and their family members as a partner in designing the innovative and need based programs in order to promote, protect, and support the breastfeeding practices of mothers. Involvement of patient as a partner is very important because they are the one who would be able to share their needs, and then whatever the programs and policies that are being designed, it should cater those needs that they are having. So their involvement as a partner is very important. In our study, I'm glad to share that we had the patient partners involved, not only the community organizers but also the immigrant mothers were our patient partner in this study, who really contributed a lot and also helped in recruitment of our study participants and dissemination of the knowledge. Our third recommendation is that the breastfeeding practices of immigrant mothers can be promoted through the healthcare supports, culturally appropriate services, better interpretation services in the healthcare settings, implementation of the baby friendly initiatives in the hospital and community based breastfeeding campaigns, as well as the follow up care and services. Our other recommendation is that the use of social media, helpline, and telehealth is actually recommended to provide the need based breastfeeding counseling to the immigrant mothers in their preferred language. So that's how we are more accessible to those mothers even during the time of pandemic, where there is no direct contact between the mother and the healthcare facilities most of the time. And that's how like the technology can help us better to reach out to those mothers and provide services that are need based and in their preferred languages. Our another recommendation from this study is that the partnership and collaborative efforts by the interdisciplinary professionals, governmental and non governmental organizations are also recommended to extend the social support, facilitate the resilience building, promote health, and build the capacity of the immigrant mothers with the young children. So, as we learned from this study, that there is a involvement of the different type of the collaborators and interdisciplinary professionals, not only the healthcare providers but also we need the involvement of the workplace supervisors, their colleagues, the policy maker, and people who are dealing with the environmental designing, even in the post-secondary institutions where mothers are actually studying, there should be some kind of the facilities. And for that, we really need the interdisciplinary collaboration and better partnerships. So here is the link to the knowledge translation video that we designed from this study that summarizes the whole perspective on the baby-friendly initiatives needs of the immigrant mothers in Saskatchewan. So here are the references that I use in today's presentation. Here are my contact details. If you have any questions, let me know, please. Thank you so much for your attentive listening.